everybody. I'm super excited to introduce you to Andrew Wittwer. He's a licensed clinical social worker at the VA Medical Center. He received his master's degrees from the University of Utah in social work and public administration, and he is the program coordinator for the Caregiver Support Program at the Salt Lake VA. He's also my father-in-law, and he's amazing, and I'm super excited to share with you guys our interview on inclusive care and care of older adults. I hope you enjoy. Okay, it's going. Awesome. So I am here with Andrew Wittwer. He is my father-in-law and a social worker. And so I'm super lucky to be surrounded by people who work in the health program and like public health system. And I'm super excited to talk to him about care of older adults and inclusive care for those older adults and caregivers as well. So just to get started, what made you want to be a social worker?
Oh, that's always an interesting journey.
Right?
My initial kind of introduction to it, my undergraduate work at the University of Utah was in behavioral sciences and health programs.
Uh-huh.
And that kind of starts you on a path of where you might go, whether it be medicine or some other health profession, supportive profession. And I think for me, one of my earliest experiences was within one of the minor programs I was in it was in gerontology or geriatrics, and
Cool. Yeah.
introduced me to the field of working with older adults, and knowing that trend was going to increase, that need in terms of services was going to increase.
It's going exponentially.
Yeah, exactly. The aging of the population took me down that path, and it just seemed to be somewhat of a natural fit for what my interests were, wanting to work more directly with people, also an interest in public administration, and what could I partner that with, I guess is the best way to put that. So social work became that direct path. And it's interesting how that kind of evolves, because my initial intention was to be more in administration, which has come to be in some aspects.
Yeah.
But I've also taken on the aspect within social work, because it is so broad and you can do so many things with it, that I'm also a licensed clinical social worker and able to do clinical work, both in private practice and at the VA. So at the bottom line, I wanted to work very closely with people. I think you can do that in a lot of fields.
Oh, yeah.
This gave me a way to advocate for, in this particular case, my particular interest is working with older adults and their families, and providing those clinical services and community services. So it was just kind of a natural direction for me to go that way.
Awesome. So it just kind of fit.
Just fit.
Yeah, perfect. And so then how long have you been at the VA?
I have been working at the Salt Lake VA for the past 19 years. I started in November of 2002, right around the time of the Olympics.
Nice.
So exciting time to be up there on the hill.
Oh, I bet.
I've been at the VA for 19 years. I've worked, again, one of the pluses, if you will, of social work and its breadth is I've worked in crisis intervention. I've worked in mental health, inpatient medicine, home-based primary care, employee assistance program, and caregiver support. So I've been
like all of these
facets within that, and in this particular population with veterans, which is kind of a wide range of patient care. We have our younger veterans, our Iraq veterans, and we have veterans that are still alive and having served in World War II. And everyone in between. So it's a great group, and it's really from a clinical aspect, it's a great thing. From a public service aspect, it's a great opportunity to serve people that have served us. So
absolutely,
it's a great thing.
That's so cool. And so what exactly do they do at the VA? Like, so Veterans Affairs Office, what VA stands for, like what exactly do they do? What does it all cover, kind of a thing?
Okay. Well, there's a variety. There are really three components of the VA. There's the Department of Veterans Affairs,
Mhm.
Within that is the VA Healthcare Administration.
Okay.
So that's the hospitals.
Yeah.
We have the VA regional offices, which is all the benefits.
Uh-huh.
And then you have the national cemeteries. Most
Oh,
familiar that most people
cool.
are aware of is like Arlington Cemetery in Virginia.
Oh, no way. I didn't know that that was part of it. That's
So
very
that all falls under the Department of Veterans Affairs.
okay. Cool.
My role is within the VA Healthcare Administration, so the hospital side of things, medical care. And really, I mean, if you go back to the mission of the VA mission is to care for those, the quote is from President Lincoln, to care for those who shall have borne the battle and for their families, caregivers, and survivors.
Perfect.
So that's the mission statement of the VA, is to provide care to those who have been in battle,
Yeah.
to those that have supported them, whether that be immediate family members or caregivers, or those that, in many cases, they're for veterans that have lost their lives, to care for their spouses that or family members that have been left behind.
They're still behind. Perfect. Oh, that's so cool. I didn't know that that was all of what it did. So that's really cool.
It is, yep.
That's awesome. And so then just like as a social worker aspect, as part of like this huge care team of older adults, what is your sort of part in that care team?
Okay, that's a great question. Social work has a lot of different facets. As I kind of, maybe with my example of where I've worked within the VA healthcare system, social work has its place in a lot of different areas. There's mental health. There's a very robust homeless program, because unfortunately a large percentage of homeless people are veterans. 1 out of 4, it was the latest.
That's crazy.
1 out of 4 homeless people you see out in the community is very likely a veteran that has served.
Yeah.
So homeless program. Then we have our medically complex homebound group. They call it home-based primary care. These are veterans that can't come to the VA.
Yeah.
So there's programming to take services to their home. Kind of harkens back to the day of home visits by doctors. That's kind of been revitalized again. So social work has its influence in all of those aspects. As a member, and with each of those, more often than not, because it's a medical model, oftentimes it's based on a structure of interdisciplinary care. And what I mean by that is that you have multiple disciplines working together as a team assigned to a patient, or a patient assigned to that team.
Yeah.
As a social worker on that team, our specific roles have to do with generally with assessment of the veteran, and in all facets, in their medical, their social, emotional, financial lives.
Wow, just kind of everything.
Address that, yeah.
Wow, that's crazy.
And so, yeah, we're interfacing with the veteran, with the caregiver and their family, and with the medical team, and the resources that the social workers bring to the table, whether that be, as I said, financial resources or housing, or coordination of care when they leave the hospital to go to another care setting, a nursing home, or home with home health. Social workers are involved in all of that coordination and helping that all run. Nurses have their specific responsibilities. Doctors, of course, have theirs.
Absolutely.
But they don't really get into what happens to the veteran once they leave the hospital. Social workers are the connection between those two.
So there needs to kind of be like this nice, streamlined sort of.
The phrase in healthcare is called continuity of care.
Yes, perfect. That's awesome.
And it's supposed to be fluid so that it fits what the needs are.
It's not super chopped up and awkward.
Then beyond that, you have more specialized roles for social work clinicians, licensed clinical social workers, who are what they call independent licensed practitioners. So they can provide one-on-one clinical care in terms of counseling, and whether it's mental health counseling, whether it's other diagnostic kinds of services, and just coordinating that care.
Yeah.
So that's kind of where, depending on where you work, your role adjusts a little bit, but those are the general general ideas.
Cool. That's awesome. That's way, way cool. I didn't know half of those things, so that's awesome. So like at the VA, you said we kind of have kind of that sort of like not super like specific age range, but like a sort of broad age range when it comes to who you're caring for because it is veterans. But for you as like that social worker, what is like the average age of somebody you work with? Like, do you
Average age of the patients or of the social workers themselves? The patients?
Of the patients, yeah.
Oh yeah, I'm not sure what the average age is. Like you said, that's it. In my work experience, these past 19 years, like I said, I've worked with veterans that were 19 years old, 19-year-old Marines. And I've worked with one of my oldest patients currently is 103.
Oh, that's awesome.
So I don't know what the average is there, but it probably our World War II veterans are becoming fewer, of course. They're in their late 90s now, or early 100s.
Yeah.
And then we have our young veteran population that had served in Iraq and Afghanistan that are now in their mid-20s.
Yeah.
And then we have a large group of Korean War and Vietnam
War veterans.
They're hitting their mid-70s. And that's probably the largest bulk of patients at the present time is that Korean War, Vietnam, and then Persian Gulf War.
Perfect.
So we're grateful to be able to have the service to provide them. It would be nice if we could stop creating wars, but
yes, definitely. That would be great.
but we're grateful that these men and women served that way. And
absolutely.
That's the bulk of, I would say the average right now, if I had to pick a number, is probably going to be between probably 50 and 60 years old.
Okay, perfect. That's great. I've talked a lot this week about care of older adults, and so like hearing about those older adults, what they've been through, like how many people could be part of the care team? So you talked about like your part as a social worker, doctors, nurses, like what all people could be part. You mentioned like financial as well. Like who all could maybe be part of like this care team for an older adult?
Okay. Well, if I'm thinking of every veteran that comes into a VA healthcare system, system of healthcare, is assigned to a primary care team. They call them PACT teams. The government loves acronyms.
Yeah.
So PACT is patient aligned care teams.
Okay.
And on that team, other team members that you would have would be a physician, a nurse case manager.
Okay.
You'll have a social worker assigned. Other members of that team would be your administrative assistants, so all your schedulers.
Okay.
And then you have your specialists. You have your mental health teams, psychiatrists, psychologists.
Yeah.
You would also have your specialists in terms of speech pathology, audiology, podiatry.
Oh my goodness.
Neurology, all the specialists that are all the people that are referred to in terms of consultation outside of primary care are all part of that team.
Yeah.
And then you have other specialty care services, such as I said, home-based primary care, home health, homeless program. You have caregiver support, which is what I'm part of now, and investing. The VA, we'll talk about that in a second, but the VA is investing a lot of energy and actually taking a caregiver and raise them to the level of basically a veteran. Caregivers are now enrolled in the VA healthcare system.
Well, that's awesome. I think that's great.
They have their own patient record, and we work with them, provide clinical services to them, and we're documenting in their record just as if they were a patient.
Perfect. Wow. So there's a lot of people that can
go. There's a lot of people, a lot of moving parts. Very broad.
Yeah. Wow. And so like, hang on. So with that being said, like there's so many people, why, like what happens if it's not inclusive care? Why does there need to be this inclusive care? Like why, like, I mean, it sort of makes sense why there needs to be like everybody talking, like what kind of happens if there isn't? like
point.
all this
Great point.
communication and the continuity of care, like you said.
Yeah. Let me just read you something, Hannah, that kind of captures that, kind of give you the question you're asking is really important, and that is why. You know,
Yeah. Like,
what is
the purpose?
why do we even need it?
Yeah.
What does it even mean? There's a document that I'll share with you, and it's about the public health crisis regarding caregiving.
Yeah.
And inclusive care and caregiving are essentially one and the same issue. That's what inclusive care is involving family members.
Mm-hmm.
Let me read this to you. Roughly 34 million adults in the United States smoke cigarettes. Approximately 76 million adults are obese. 23 million adults have been diagnosed with cancer. So all, from a public health standpoint, all big time events.
Yeah.
Right? And
kind of big crises.
Talks about research and dollars are rightfully dedicated to searching for solutions to these commonly accepted public health challenges.
Mm-hmm.
While comparatively scant investment is made in the health and well-being of family caregivers, who number 53 million.
Wow.
53 million caregivers that provide care to veterans.
Just veterans specifically.
Caregivers in the world, right? But a large portion of those are to veterans.
Yeah. Wow, that's crazy.
So, and there's this direct connection when you look at it from an inclusive care standpoint through the VA. The way we're looking at it is basically this: a veteran is receiving care from these primary care teams and VA staff and so forth, but it's smaller touch points, right?
Mm-hmm.
The majority of the time, the veteran is then sent home to be with whom?
Like
with caregiver.
Yeah.
As that caregiver's health declines, or if there's any short-term health crisis, long-term health crisis, there's a direct impact on the veteran's care. And in many cases, a veteran is literally one person away. If something happens to that person, their health care situation changes.
Yeah, absolutely.
For example, their spouse taking care of them. If she gets sick or gets hurt, has a fall, whatever it may be, that veteran isn't able to live independently. They have to go into a care center for a time, move somewhere else. So the idea about inclusive care is these folks are providing the bulk of the care for a lot of people. And we as healthcare systems, VA and then beyond, just in the community, don't have the resources to replace them.
Yeah,
so
they're vital.
Some time and healthcare dollars and research, just like with obesity and diabetes and cancer and cigarette use, increase their health and overall well-being so that they can continue to provide care. Because the system cannot take on the demands of what 53 million caregivers are providing. Our healthcare system as a whole, not just VA, but as a whole, we can't do it. So VA has then adopted this philosophy, which is really a joint initiative with what's called the Elizabeth Dole Foundation. Robert Dole was a senator, and his wife has championed this. Elizabeth Dole has championed this foundation to advocate for and provide services to caregivers. So that foundation and the VA have partnered together for an initiative called the Academy for Inclusive Care. It's an intent to change the culture of healthcare within the VA and hopefully beyond that to include caregivers as an active member of that same. You asked who's on that team. Who's taking care of that veteran?
Who's taking care?
We want to change the concept, the culture that says that one of the first people that's included on that team is the veteran and the person who's taking care of them. They become an active member of that team.
That's awesome.
So that's what inclusive care is. Inclusive care is bringing that, is educating providers to say, one of the first things we need to be asking about of that person we're taking care of, whether it's a veteran or a non-veteran, is there somebody taking care of you? And if so, what do they do? What do they know about you on a day-to-day basis? How are they involved? How can they help us make good, sound healthcare decisions.
Absolutely.
In a nutshell, that's what inclusive care is.
That's so cool.
Is that cool?
And so like with that, what exactly is the VA doing? So you said that they're including them as part of like the care team, like they're putting them on the team.
Yes.
Are they providing chances to be educated, like for caregivers to learn more about the care that their loved ones are receiving? Like what are they doing for them to be able to care for their loved ones better?
Great question. Great question. So inclusive care is intended to be system-wide within a healthcare system. And when I'm speaking specifically of the VA, I think other healthcare systems probably provide something like this.
Yeah.
I think it though is not just specific to the VA, but the VA is really championing this at the moment.
Yeah.
Because we work so closely with caregivers. But the intent is three E's: to embrace, to engage, and to empower a caregiver, a clinician, and the veteran on that caregiving journey or that healthcare journey.
Yeah.
How do we bring them into it? So there are five components that the VA is doing right now. One is system level policies of inclusion. We're trying to change the culture.
Okay.
It becomes natural for a doctor or a nurse or a social worker or a front desk personnel to be aware that one of the integral parts of this care team and understanding the veterans' health care is, do they have a caregiver?
Yeah.
That caregiver recognized, and have we met with them? Have we talked with them?
Okay.
So, and then defining, the other thing is defining who is a caregiver. What does that mean? What is it? Are there certain aspects, certain responsibilities that make that person a caregiver? Or who's identified in terms of, is it my spouse? Is it my adult child? Is it my grandson? Is it a neighbor that lives next door that comes and checks on me?
Yeah.
I had some numbers I was going to share with you just in that regard. There, in regards to VA, of 2 million enrollees in VA healthcare, 63% receive up to 10 hours of assistance a week from a caregiver.
Really?
So 60% of 2.4 million.
Okay.
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 And of that 2 million caregivers, 59, almost 60% is the spouse.
Okay. Makes sense. Yeah.
Another 29% is an adult child. That my math adds up. That's about 85%.
Yeah.
Should either a spouse or a child.
Okay.
An adult child providing care. So that's who we're really targeting. There are some other caregivers. There's other family members, paid caregivers, and whatnot.
Yeah.
Really targeting spouses who are often very close to the same age.
Yeah.
Of the veterans, right?
Yeah.
So the veteran's aging, the spouse is aging, and they're having similar challenges going on. They're having cognitive deficits, they're having physical decline, and they're trying to take care of somebody else.
Yeah.
So that leads us to the third component. So we have, level of inclusion. We're defining who the caregiver is, and then we're assessing that caregiver's capacity. What are they at the present
So making sure that they're kind of like able to take care of them, like assessing them in that sort of way.
Yeah, where are the gaps? You're able to do. We're doing an assessment for myself as a caregiver support coordinator. I'm contacting the veteran and I'm doing an assessment of the veteran. I'm thinking about, you're going to know this, having worked in the industry, activities of daily living.
Yep.
Okay. Doing an assessment of that. And I'm looking at instrumental activities such as transportation. Can they drive? Can they manage finances? Can they manage medication? Can they get to appointments? I'm looking at that. So I'm doing that assessment for the veteran, but I'm also doing that assessment for the caregiver.
To make sure that they're able to fill.
See how compatible they are. Where are the deficits? Then we're looking at actively training, educating, advocating for the caregiver to be involved in those healthcare teams. Giving them, so to speak, to say, you have a right and an expectation within this hospital, within this medical system. You're a part of this team.
Yeah.
We expect your input. We want your input.
it needs to be there.
Has to be there.
Yeah.
And then that leads, so that's the fourth, is their caregiver involvement. The fifth is just training and education between myself as a caregiver support coordinator and the teams within the VA, whether it be geriatrics or whether it be mental health, home-based primary care, any of the specialty clinics, educating those teams on these 5 concepts of inclusion and trying to help bring them up to speed so that the whole culture starts to change. Now, as you know, in a healthcare system as big as the VA, which is the largest healthcare system in the United States, culture takes a long time.
Yes.
Wheels turn slowly.
Yes, they do.
But fortunately for inclusive care, it's kind of and anybody coming into healthcare, it's somewhat of an easy sell.
Yeah. Well, it makes sense.
It makes sense, right? It's like, why would I exclude the person who's taking care of them 24 hours a day?
Exactly.
They come see me for an hour appointment and they go home and they're with this person all the time.
Well, it's the best way to give them the best care possible, which is what they need.
So that's kind of what the VA is doing right now. And that's being implemented in a variety of ways. That we have what are called inclusive care champions at the VA. I'm the one for Salt Lake VA.
Okay,
and so I have the responsibility of teaching and training my colleagues about this concept. I've done some recent trainings with Social Work Service as a group, which was over 100 social workers, about these principles of inclusive care, which is just some basic mental tools and processes of considering and empowering, as I said, engaging that caregiver in the process and trying to step those principles to other teams that talk to veterans, talk to caregivers every day.
Yeah, just like a way to kind of change the mindset, make the shift so that they can have that be like their first sort of thought process. Exactly. That's awesome. And then, so just really quick, kind of maybe final couple minutes, how is the best way? So the older adults, they have this caregiver, they have a variety of caregivers, and frequently we talk about like that either the spouse or children or maybe somebody else. What is the best way for the caregiver to maybe take care of themselves so that they are able to be that caregiver, so that they're able to do sort of their job in a sense, to take care of their loved one, to take care of their older family member who maybe can't do things for themselves? How would they best take care of themselves?
Best way? Caregivers, I think if you were to distill it down to one or two things, one main thing is educating and teaching a caregiver how to ask for help.
That's important.
Caregivers are very strong people. They're doing one of the most difficult jobs in the world.
Absolutely.
Whether you're a paid caregiver or you're unpaid, right? As a family caregiver, you're just doing this out of the goodness of your heart, because you're devoted to that person.
Yeah.
I think one of the first steps in self-care is one, acknowledging that it's a true need, and having that need validated and normalized. And sometimes we do that in individual coaching with them. We do it in group settings where they get on there for the first time, and we're doing a lot of virtual groups right now, and they're talking with other caregivers and realize, oh my gosh, I thought I was alone. I thought I was the only one that dealt with this. And oftentimes there's a really significant resistance by caregivers to reach out. They feel like they have to kind of do it on their own, or they're the ones that can do it best, which is true in many cases. But a lot of times they need support services, whether it be home health, adult daycare, some involvement from the VA. Maybe they need that caregiver, her and I, or he and I, talking like this virtually, where we can talk about more clinical issues of, yes, I have some caregiver burden, I have depression, I feel overwhelmed, or whatever it may be. But really the first place where we really try to get them to is that there is help, there is support through education, resources, whether it's within VA or community or both,
Yeah.
but getting them to a place emotionally that they say, you know what, I feel like I'm okay to ask. And it is okay
Yeah.
to ask for help.
They should.
And then from there, it's you kind of tailor it to where their needs are. And
Yeah.
some need more help than others, but it's that big hurdle is making that ask, making that step to say, I'm a little over my head here.
Yeah. And like what you said before, frequently those that are taking care of their veteran spouses are, older themselves. And so it's kind of like this whole mix. So you have older people caring for older people, and it's everybody needs help and everybody needs to be cared for, and it's okay to ask for help, and that's awesome. So perfect. And so kind of to educate ourselves better on how to care for older adults, what would you recommend? Like checking out the Inclusion Care website, or like what?
Yeah, you could go to campaignforinclusivecare.org.
Okay.
You can go anytime. In any community, you're going to have some form of what's called a AAA.
Okay.
An area agency on aging.
Okay.
And that's going to be at your state level, your county level. There's going to be some aging services.
Okay.
And we're talking for the community.
Yeah.
For VA, you can go to caregiver.va.gov, which it's a huge resource for caregivers. Lots of resources and information there. But yeah, it's a matter of understanding where you are. We have here in Utah specifically, and for the VA, the VA has this. Salt Lake VA has a coverage area of Utah, part of Nevada, part of Wyoming, part of Idaho. So we have
really
rural veterans. I have veterans that get on and they're calling in from East Carbon, Utah.
Wow.
And Carlin, Nevada, all at the same time. And I'm talking to them about caregiver issues.
Yeah.
So the whole thing with COVID and all that's gone on with that has really pushed us, because before caregiver support was kind of exclusive to, can you come up to the VA? Yeah. Well, that doesn't fit anymore. That doesn't work. I don't think it ever worked. But now we have more tools to reach more people.
Yeah.
So there's help out there. And if it's within the VA system, you just call a VA. Right now, you're going to get a caregiver support coordinator at every facility.
Cool.
In the community, you go to something like Salt Lake County Aging or any aging services website, and it'll link you to community resources, education classes. It's just a lot of it's about getting educated.
Okay, cool. And I'm a huge advocate for education. I think we all need to educate ourselves more on the issues, because that's the way things will get better. That's the way things will change. So, well, thank you so much for letting me learn a little bit more about what the VA is doing, how to care for older adults. It's a huge issue because, like what you said, the population is aging and it's a trend. And so it's something that we'll need to know about more. So thank you so much for letting me
welcome.
Talk to you more.
So glad to do it. Thank you.
Perfect. Absolutely.